afternoon, everyone. My name is Peter Guan, and I'm a program manager at CFPIC. Thank you all for joining our second CalAIM Brown Bag. Our CalAIM Brown Bags are an ongoing monthly series. Special thanks to CWDA for their support. This webinar is recorded and will be posted on our CBSI website. The webpage link is in the chat. Today's topic is on CalAIM housing supports and how to maximize home safe funds. The training session will be facilitated by Baojit Hundal and Gretchen Schroeder. They will help you understand all the housing community supports and how to maximize unspent home safe funds with referrals to CalAIM housing community supports. Baojit has over 30 years of experience in health and human services working in the public and private sectors. She was previously the lead for CalAIM implementation in Mariposa County. Gretchen is a community health strategist with over 20 years of experience working with community-based organizations, counties, and healthcare providers. With that, I'll pass it on to the presenters.
Great. Thank you, Peter. Welcome, everyone. We do have a pretty extensive slide deck that we're going to go through, but I'm going to bring that up now real quick here. All right. So appreciate you being a part of our Brown Bag series today, and really are looking at focusing on home safe and how you can lean into the array of community supports that are available under CalAIM and your managed care plans in your counties. And so we're going to start off with just kind of doing some level setting around home safe. And I had sent out a survey back in January to kind of see where counties were with home safe. And so I want to share some of those results. And then we're going to get into what CalAIM is. Gretchen, my colleague, is going to walk you through that. And one of the great benefits under CalAIM, enhanced care management. And then I'm going to talk to you about community supports and really, again, highlight the housing community supports and some additional ones that I think would assist you if you're working in home safe and if you're a county that is spending down your dollars, or maybe have already shut your program down. There's still opportunities to kind of lean into additional services to support APS clients. And then we're going to talk about transitional rent, which is a new community support. And then we're going to open it up to see what the experience is with referring to community supports and trying to link clients that you're working with in your counties. So real quick, so we did have, like I mentioned, we did ask counties and our home safe contacts in every county to participate in a survey. And we had 38 respondents to the survey, which I think is really great. So of the 58 counties, 38 did respond back. And one of the first questions that we asked was, how was your home safe program structured in your county? And what you'll see is 50% of the respondents indicated that it was being run through their APS department. And so we, through the surveys, we found that majority of the program was being kind of dually done with APS workers who were also managing home safe as well. So, and then, and the other thing that we found is that the other question that we asked was, where are you in the Home Safe program? Have you already spent the money? When are you looking to spend the money? And majority of the counties that responded did share that they were looking to spend down by June of 2026, which was a great opportunity for us to host this webinar and really talk to you about these CalAIM benefits. And then we had a small percentage that have already shut down the program. They've already spent their money. And then the next large group that was looking to shut down the program and spend the money by June of this year. So, and so again, this is an opportunity to help our APS staff across the state and our home home safe staff across the state look at the alignment with CalAIM and look at the benefits to referring APS clients to enhanced care management, which is a year-long case management program to help folks who are seen by the state as the most vulnerable and highest risk on Medi-Cal, and then also these community supports, which are seen as in lieu of, and you don't have to meet a certain population of focus, and we'll get into that more later. But and then the other couple of questions that we asked as part of the survey was what were the needs of your home safe clients? And so here you'll see the array there, and you'll see majority was for helping with arrears, housing related case management, and rental assistance. And then we've got utility payments, decluttering services, home modifications, landlord mediation. So a lot of these services and needs that you are or were meeting in your home safe programs, we're going to link those to community supports that also do a similar service, and really help you see that just because home safe is, sunsetting or has already sunset in your county, there are still other services and benefits that you can refer to, or, and I'm going to make a plug here, maybe even become a provider of some of these community supports as well. Now there are a couple of things that, because there was so much more flexibility in the home safe program with the dollars, and just I actually, when I was in my role with Mariposa County, overseeing all the adult and aging, we were part of the pilot for home safe, and so stood that up and really found it to be a great program that had a lot of flexibility. And so really looking at what the needs were in your community with your aging population. But there are a couple of things that I think, because we had that flexibility, that they're not going to clearly align with some of the community supports. And so, buying furniture, appliances, some of those things that some counties were using the funds on, that may be limited on this side of CalAIM and community supports. But again, we'll get into that. So one of the questions also asked, what was the biggest challenge with home safe programs, and what you were trying to achieve there? And again, what I saw in the survey responses was just locating affordable housing. This is tied to a population that may have a very limited income, and maybe they were in a home for a long time or an apartment or whatever it may be, and they're at risk of losing that, and now trying to find affordable housing when housing costs have gone up so much significantly, that I could definitely see as a challenge that a lot of you faced in your home safe programs. And then another thing that stood out was just the running and staffing of this program within your APS department. That seemed to be a big challenge that came across in the survey responses as well. And then just another question that I wanted to lift up in the survey was, were there any unmet needs of home safe clients? And if so, what were those? And so again, it was housing, lack of a support system that particular APS client had, difficulty finding housing, again, with a population with very limited financial resources, inadequate housing for this population. Yeah, right. So maybe you have housing, but it needs modifications, or it needs additional things for this aging person. And there is a community support that we can lift up today that could help with that. And then housing navigation. And I would say that for counties that decided to place home safe in your APS department and made it a part of an APS worker's responsibilities, that's a whole new set of skills that APS workers needed to learn, right? How do you find these places? So housing navigation, how do you find them? How do you find the time to really do all of that footwork to help folks get into the right places? And then how do you work with landlords to, maybe keep folks in their places? And so these are some of the challenges and unmet needs that came out in this survey. Just want to pause. If there are any questions, you can definitely put them in the chat or you can raise your hand. As much as possible, we definitely want to make this a discussion. So yeah, please put it in the chat or raise your hand as the question comes up. So I'm going to hand it over to Gretchen to go over the next several slides.
Great. Thank you, Baljeet. Hi, everybody. I hope you're having a good Thursday. So we're going to jump into CalAIM Medi-Cal transformation, and many of you may already know a lot about this. And if you don't, there's some good backdrop slides. And we also have some webinars that we did earlier this year and last year that goes into more details on what CalAIM is. So if you're looking for some background info, please check those out, and they're on the CFPIC website. Next slide, please. So very simply, I'm just going to cover Medi-Cal and just kind of give you some reasons of why we're all seeing this being pushed through our Medi-Cal managed care plans and why this is happening in the structure that it is. So Medi-Cal is California's public health insurance program. It's really designed, it's the Medicaid program. We have to rename everything in California to Cal, so we're Medi-Cal, but it's really designed to give folks the basic health services that they need. And in California, roughly every month, we have about 15 million folks who are enrolled in Medi-Cal. That's an important number. It varies. We think it'll go down to about 14.5 million over the course of this year. But that's about where it lands pretty much month to month. And basically, and this is very, very simple, but basically for Medi-Cal in California, the state pays about 50% of the cost and the federal government pays the other 50%. Now, for certain populations, for certain programs, that ratio does shift. But if you can think about that very simply as being a 50-50 split, California does incur a lot of costs through the Medi-Cal program. What's important about Medi-Cal for CalAIM and for ECM and community supports is that the state thought about how do we really make the biggest changes, impact the most people, how do we do this? They looked at where everybody is enrolled. And roughly speaking, between 90 and 95% of people who are enrolled in Medi-Cal are in Medi-Cal managed care. So when they thought about how we implement these changes, impact the most people, they wanted to see all of this happening through the managed care system, which means that a lot of the oversight of these programs, a lot of the contracting is going to be happening through the Medi-Cal managed care plans, not with the state. Next slide, please. So the state had this great vision of transforming Medi-Cal. They started out calling it CalAIM, which is been the initial name. They've tried to rename it to Medi-Cal Transformation. It hasn't quite stuck. So you'll see these two names used interchangeably in the state and in common language in these types of webinars. But really, it's a multi-year effort trying to build a more coordinated, person-centered, and equitable health systems. They're really trying to say, how do we serve an individual with all of their needs, not just their physical health needs? How do we start to break down silos so we don't have physical health over here, mental health over here, and your housing needs over here? So really trying to think about how do we serve that one person in a holistic way. And of course, the state is really trying to leverage these programs to be catalyst for equity and justice in California. So there's that premise in all of these programs. Next slide, please. So CalAIM has 11 different initiatives. And they're structured a little bit differently. We're only going to cover these top 4 in blue here, which are going to be community supports, which Belgie alluded to a little bit in her introduction, enhanced care management, the incentive payment program, or IPP, you'll hear it called, and the providing access and transforming health, or PATH initiative. The others are really important, and they're being implemented either by counties or by other managed care plan initiatives. Next slide, please. So as we think about this and why does it matter to all of us here today, I think we set the stage pretty well early with, home safe is sunsetting. So how do we look for other ways to support folks in the housing arena? But even beyond that, I do believe that CalAIM Enhanced Care Management Community Supports does offer new revenue streams, which can extend support and services for the individuals that we're working with. These are new programs and benefits that can really help individuals. They may offer different timelines. Some of the county programs that folks are enrolled in, they may offer a more expansive set of services. So they are an opportunity to get folks more care that they may need. And then the biggest one the state is really pushing is how do we break down these silos and start to have a more coordinated system of care here? So really trying to have our housing providers talk to our clinics who are going to talk to our behavioral health providers. So really trying to break down these silos that we've been living in for many, many years. Next slide, please. So I'm going to quickly cover enhanced care management. This isn't quite the focus of today's presentation, but it does set the stage for the other things that are happening. And if you do have clients you're working with who, in addition to housing services, may also need some support in trying to coordinate all of their health, physical health, mental health, behavioral health, SUD services, all of that can be run through enhanced care management. So just kind of as an FYI for all of you today. So enhanced care management is a new statewide Medi-Cal benefit, and it's really designed to give an individual one care manager that helps them navigate all the different systems of care that they are having to navigate for whatever issues they have. So if they have behavioral health, get their doctor's appointments, they need to see a therapist, if they need housing, if they need income, the enhanced care manager can really help them access all of these different systems. So really trying to coordinate care. It is designed to be an in-person approach, though we know in some counties that's harder to do than others. With workforce issues and mileage. So we're trying to address that, but we haven't quite seen this be a reality for everybody. Next slide, please. So ECM is designed to really serve the top 3 to 5% of Medi-Cal managed care members who have the most complex healthcare needs, who are traversing, multiple systems of care, and who are the most expensive Medi-Cal patients. So we're really trying to identify who those folks are, and we're trying to work with them to really get them to access the most appropriate level of care, help them get more stable, and really have that lead care manager assist them with that. So ECM is what we're talking about today, but there are other care management programs that Medi-Cal managed care plans run. So if you do have clients that could benefit from care coordination but may not qualify for ECM, the managed care plans also offer a complex care management program, and that can help folks navigate some of the care settings they have in the hospital or with doctors' offices, and then some basic population health management, which is really for the lower level of risk that some folks may experience. So the other important piece here is that ECM, if someone's enrolled in ECM, it's designed to really help folks transition between levels of care. So if someone's been in the hospital or a skilled nursing facility and they're transitioning back home or to assisted living, the ECM care manager can also help individuals navigate those different transitions. So again, if you have clients who may benefit from this level of coordination, you can make referrals for them into enhanced care management. Next slide, please. So the state did this wonderful thing when they designed enhanced care management. They actually wanted to roll this out to different populations of focus. So we didn't overwhelm the managed care plans. We didn't overwhelm, our providers. And so they started out by having folks who were experiencing homelessness came out of whole person care. That was the first population of focus to enroll in ECM. They really wanted to see, how do we get these systems set up in place? How do we really start to build the provider network? And they've since rolled out all 9 populations of focus. The birth equity population of focus was the most recent to go live, and that was back in January of 2024. So all of these populations of focus are live. If you're wondering who qualifies for which population of focus, I've just put in the chat the ECM policy guide, which has a very detailed list of eligibility criteria. And you may have folks that qualify for multiple populations of focus. You can make referrals and check every population of focus they may qualify for in your referral form, and then hopefully get them into the services that they need. Next slide, please. So very brief overview of ECM, really care coordination, but now I'm going to get back to Baljeet to talk about community supports and how some of these may fill some of the gaps that HomeSafe may have as funding sunsets.
Great, thank you, Gretchen. And just to highlight real quick, again on ECM, so for our HomeSafe population that you've been serving, they would definitely fit under the individuals experiencing homelessness population of focus, but then they may also fit under another category. And when I looked at the surveys responses, you know, you're working with clients that also have behavioral health needs and SUD needs, and so they may fit under that category as well. You also may be working with adults who maybe didn't qualify for HomeSafe, but are also at risk of long-term care. And so they would fit under 5 or 6 as well. And so, you know, ECM is a great program to look at for all APS clients, not just your HomeSafe clients that you've been working with, especially if you're in a role that you also respond to APS referrals and then assess them for HomeSafe. So really, you know, one of the programs that has not been outreached to enough in regards to CalAIM and the benefits and the services is our APS program. For those of you that are aware that there is MOUs that are being executed in several different programs that live in social service agencies. One of those is with IHSS, but there isn't one for APS at this time. And so we're really trying to target particular programs that have kind of been left off the execution of MOUs to say, this is an additional benefit resource service that is out there for your clients who are on Medi-Cal, and here's the biggest point here, and are also enrolled in a managed care plan. So to get these benefits, they have to be on Medi-Cal and enrolled in a managed care plan. Now, with some of our adults, what we have found is they may have share of cost Medi-Cal as well, meaning that because of their income, they have to put forward some, you know, dollars before Medi-Cal kicks in. They become ineligible to be enrolled in a managed care plan. So these are some of the things that you would have to kind of look into as you're assessing if they qualify for these benefits and services. So I just wanted to put that out there and kind of highlight that again, that this is a benefit if the client is on Medi-Cal and enrolled in a managed care plan. Now, it could also be a situation where they're on Medi-Cal and they are eligible to enroll in a managed care plan, but have not taken that next step. And though we don't get into that in today's webinar, it is something that we can definitely provide guidance on how to do that. In a lot of the counties, Medi-Cal recipients are automatically enrolled into a managed care plan because there's only one. But in, I want to say it's like 21 counties, you have multiple options of managed care plans to opt into, and that's where the member has to decide themselves. And so they're not mandatorily enrolled. Anyway, just wanted to put that little bit of context out there. So let's talk about community supports. So these are the pre-approved 15 medically appropriate and cost-effective community supports that managed care plans are strongly encouraged but not required to offer as substitutes for utilization of other services and settings. Now, I do want to add a caveat to this that the last one on here, transitional rent, that will be a mandatory community support that the plans have to offer, but it won't be mandatory until 2026. So this is the latest one that was added to the list of community supports, and we're going to talk about it later in the slide deck. Now, community supports are not a Medi-Cal state plan benefit, meaning they are optional for a plan to provide. However, all of the Medi-Cal managed care plans have chosen to provide the housing related community supports. And we're really going to focus on those ones. Though we have provided a slide or two on the other community supports that you might be interested in. Now, again, community supports must be medically appropriate, meaning that the person needs it from a medical standpoint as well, and can also be paired with ECM. So a client could be receiving ECM services and then be assessed for community supports and then refer to those. Or they could just need community supports and not need that higher level of ECM service. ECM, they have to meet that population of focus, which means that they're seen by the state as being a high risk, most vulnerable population. For community supports, they do not have to meet that criteria. So how do individuals access these community supports? So the state's vision for this was that it would come organically from the community, from the Medi-Cal member themselves, and from professionals like yourself who are already working with this person and can either refer them yourself or you can assist the member to self-refer. But the state really wants this to come from the community. Now, if a client is referred to ECM and accepted, it is one of the things that the ECM provider should be also doing is assessing for what community supports that this member may need. And so there are these different ways that they can be referred to community supports. But today we really want to press on you that you are one of those referral sources to refer these folks. So we've broken out the community supports into 3 buckets. Now we have not added transitional rent here because like I mentioned, we're going to talk about it later, but it's also one that is being developed currently. It just got approval December last year. And so the state is working pretty hard on getting this ready because they do have a optional go live date July 1st. Anyway, Gretchen is going to talk about that more later, but we are going to go into these ones now. The first 3 here are called the housing trio, and typically you will find that a member typically is going to receive at least one, if not all of them together. And these really align very well with the Home Safe program. And so, what you were doing in your program to find the housing, and then once they found the housing or what you were doing to keep them in the housing would move into housing deposits. And then what were you doing to make sure that they maintain that housing, which is housing tenancy. So let's talk about housing transition and navigation. It's important to understand here is that these are for folks that are experiencing homelessness or at risk of experiencing homelessness, and to help find, apply, and secure housing. Okay. So these are some of the things that a housing transition navigation service provider would assist that member with. Now, once they sign up and agree to participate in this community support, they will receive an individualized housing support plan, which can last up to 12 months. Now, if they need additional support beyond the 12 months, the provider would reach out back to the managed care plan to get additional authorization for this. And that housing support plan would be updated to justify why they needed additional 12 months. And why they weren't housed after by the 12-month mark. So This again, it's a it's kind of considered a long-term case management to really help these individuals find housing and secure it and move in. And we talk about housing deposits. Now, usually to receive housing deposits, you also have to be enrolled in the housing navigation community support. They go together. And so this is utilized to help pay for housing security deposits, utility setup fees, first and last month's rent, and first months of utilities. They can also potentially receive funding for medically necessary items like air conditioners, heaters, and hospital beds to ensure their new home is safe for move-in. There is a cap though on this. So this community support comes with dollars, right? That the member to get them to move into these places that could be paid for. And what we understand is it's around 5,000, and it is once in a lifetime. So for that member, it's once in a lifetime. And I'm just looking through my notes here to see if there's anything else that I want to lift up. And again, this is to move them in. This isn't for the ongoing rental cost, and that's what transitional rent, the 15th community support, is looking to move into that space. So this doesn't cover the ongoing rent, unfortunately. And again, housing deposits would be in alignment with their housing support plan that they would have created with that housing navigation provider. And so typically you should be finding that your housing navigation provider will also be a housing deposit provider as well. And then the last in the trio of housing supports, community supports, is the housing tenancy. So it's a three-step process, right? When you're looking to help folks in the housing space, it's first finding the housing, securing the funding so that they can move in and pay for the things to get that move in. And then how do we help them sustain that housing? Now that we've got you into a housing unit, how do we sustain that housing? And so that's what this last in the trio is looking to provide. And so just like housing navigation, it's looking at receiving housing resources, working with that community of housing providers through that coordinated entry system or something similar to maintain that housing so that they don't lose it, right? And so this slide just shows you some of the things that would be provided when a member moves into this community support. Now, you do have to refer to each one, but if you've referred to the housing navigation, I would assume that that housing navigation community supports provider would then make the referral and get the authorization for housing deposits and also get the authorization and approval to provide housing sustaining services. And again, I think a lot of our housing providers are probably providing the trio of services as they really align together. Again, just like the previous one, this is a once in a lifetime benefit or once in a lifetime service. And so coordination is really critical here. And making sure that we've looked at other potential housing programs that the client may be eligible for, and coordinating when is the best time to use this one versus the other program, because this is a once in a lifetime option. Let's see. Just looking at my notes here. Any questions? Okay. And then Gretchen did put in the chat the policy guide, which goes into a lot more detail. And then also put in there a link to which community supports are actually offered in your particular county. Because again, this is a opt-in for managed care plans, and they can add or delete community supports that they're going to offer in your county every 6 months. So that link is for December. And then in June, July, we'll get another updated list of what's being offered in your counties. All right, so the other ones beyond the three first main housing community supports that are offered as part of that housing trio, we have recuperative care. So these are for members with unstable housing who maybe are coming out of a hospital setting and they don't need that level of care, but they still need to recover from injury or illness. They need some short-term residential care. This is an option for them. It's kind of like, and I want to say it was in the right here, medical respite. There we go. It's seen as medical respite, right? So these are folks that need that additional support and healing and don't have a place to go to get that. And if they don't receive this, and for example, if they're going to end up back on the streets, they're going to end up needing to come back into the emergency room, because they didn't have time to recover and heal. So it's seen as a way to address that. So again, it's a bridge between hospital and emergency departments and homeless shelters that do not offer medical care. It's part of that continuum of care of homeless services. And there's about 41 recuperative care programs in California. And so if you're seeing that a lot of your referrals, and I remember when I was overseeing APS, in the last county that I was in, a lot of the calls that we used to receive were from the hospital and not having a appropriate discharge or a place for the person to go, and they clearly needed some additional assistance and housing because it would benefit their healing from the illness or injury that you know ended them up in the hospital to begin with. So recuperative care. Um, So again, they're at risk of hospitalization. They don't have those formal supports to help them if they were to return home. They're housing insecurity or at risk of being homeless or are actually defined as being homeless. And so this is something in addition for them. And then in addition to that, we also have the short-term post-hospitalization housing community support that can be utilized. And again, this is for members who do not have a residence and who have high medical or mental health and substance use disorder needs and require or need short-term housing for up to 6 months to continue their recovery. So to receive this community support, members must have been discharged from an inpatient clinical setting, residential substance use disorder treatment or recovery facility, residential mental health treatment facility, correctional facility, nursing facility, or maybe they were coming out of that recuperative care, medical respite, and continue to need housing and support. Yes, I see a hand raised. Is it
Yeah,
Deshelle?
yes, that's my name. Thank you. So my question is for this community support in terms of payment of this, so like they're coming out of a correctional facility or they're coming out of a residential facility, would this allow for payment maybe at a sober living home of some sort
It
or
has to
something
be
similar?
a provider that has contracted with the managed care plan and has been vetted through their process to be a
Okay,
provider for this service. So it can't just
okay,
be anyone out there in the community. They have to actually contract with the managed care plan. Now, if you know of providers that you have used or referred clients to, I would definitely reach out to them and say, hey, have you heard about community supports? I think you would be great to come on as a provider. Then the managed care plan pays that provider directly.
Okay.
Does that make sense?
Yeah, that makes a lot of sense. Thank you.
Yeah. And you can find out who is the providers for each of these community supports on your managed care plan's website. They have to keep a list of who the providers are there, and so it would be in their network of providers directory.
Okay. I think for our county, and I'll have to double check, I don't think we have this.
Hmm.
I don't think
What
there are any
county are you
providers
in?
providing. We're in Ventura County.
Okay.
We don't, I mean, we have the community support, but I don't think we have any providers provided. We have very few
Okay.
CalAIM providers.
Yeah. And it's something that, managed care plans are still growing capacity, especially in community supports where maybe they're seeing a high need, but not enough providers. So they're continuously looking for new providers for some of these community supports where they don't have enough.
Okay. Thank you for answering my question. It's helpful.
Yeah,
Thank
no,
you.
definitely. All right. I'm just looking at the time. So making sure we get to all of these. So again, with the housing community supports, the 5 that I just very quickly went over, it's really looking to build on a housing first model. It's looking to provide case management and stabilization for our medically vulnerable individuals, and also helping to link them to long-term supports. Again, I really want to plug that for your APS clients that also have housing instability or are homeless or at risk of homelessness, I would definitely pair and look at referring them to ECM to get those long-term case management, care management services under ECM, as well as referring them to the applicable housing community supports that you feel that they need. Now, the ECM provider, once they're authorized, would be also doing that, but you can do them together. Okay. Now, the next are, and I'm going to kind of run through these pretty quickly because I see that we're already at 12:45 and we're done at 1. And I do want to leave time to talk about what counties are seeing right now, like what's happening at the local level. But the 2 that I'm not going to cover, but they're in your slide deck, is the 2 at the bottom here, the nursing facility transition and community transition services. We have several slides on this. So this is keeping folks out of our long-term care facilities and also looking at moving folks out of long-term care facilities back into communities. So definitely look at those slides, but I want to spend some time looking at this environmental adaptations, which is home modifications. So, because in the survey, what I saw is a lot of what the money was being spent on was helping folks remain in home, making it more of a home that they can be in. And so this is a great community support that you could utilize to keep folks in their homes. And so this is going to help pay for, like it says on the screen here, ramps and grab bars, doorways, making bathrooms and showers wheelchair accessible. And and some of the things that I think counties were utilizing the home safe funds because there was so much more flexibility there. And it doesn't maybe fit one of these criteria that we have on the slide, I would still refer and help this member get this community support. Because if you can show that it's needed to keep the to keep the client in the home and it's medically necessary, you can make a case for this, right? So some of the things that you guys were helping with in the Home Safe program that maybe doesn't seem to fit this exactly, if you can show that it would prevent them becoming homeless and it's a medical necessary modification, you can make that case to the managed care plan. Because again, this community support is really looking at keeping the member at home and keeping them out of a long-term care setting. And it's looking to promote their health, wealth, safety, and independence, ultimately. Deshelle, I see your hand raised.
Yeah, so one question I have too. So in terms of the modification services for community support, so let's say we were able to house a client through another service like rapid rehousing, since the deposit service is only once in a lifetime, would we still be able to use these community supports to make those modifications to a home?
Yeah, I mean, I think it would need to be in coordination, so that you're maximizing both programs. Um, and if the other one doesn't have that lifetime, criteria, maybe you utilize that. Because I think what we do find, right, in the process of life is that today I need it, but I might need it again later. And so if you're able to utilize the other program now and maybe save this for later, maybe do that. Now, this comes with around a 7,500 maximum limit for funds. And, maybe it's a combination of both, because maybe the modification is so expensive that you need both to do it. Does that answer your question?
Yes, that answers my question, and it helps with building strategy too. So thank you very much.
Yeah, a lot of this is really about collaborating and coming together with all the various programs to meet the needs of that individual, and which ones go first, which ones maybe you stagger for later, so that you maximize all of this for them. Yeah, so it needs to be done in a very coordinated process. All right, so like I said, I'm going to skip over these right now. But the information is there. And then these are the third bucket of community supports. Again, we're not really going to get into these today, but these apply to our APS clientele as well. And we've kind of talked about it here in this slide. You can lift these up for your folks that need, maybe additional support with a care provider. We have personal care and homemaker, and maybe they don't qualify for IHSS. They don't meet the eligibility there, but they need assistance. Or maybe they are getting a caregiver, and to prevent that caregiver burnout, they need somebody else to come in to give the caregiver a break every once in a while. So a lot of additional great community supports are part of the services and benefits that your managed care plan may offer in your county. All right, I'm going to turn it back to Gretchen to talk about transitional rent.
I'm just going to do a very brief overview, maybe next slide, Baljeet, and I'm going to put a link in the chat here for a webinar the state gave a few weeks ago on this. You'll get these slides, so I'm just going to highlight this. There is a new community support service that is going to offer up to 6 months worth of rent for qualifying individuals. We have some eligibility criteria here. Folks need to have some clinical risk issues, need to be experiencing homelessness or at risk of homelessness, and need to be transitioning from different settings. Next slide, please. And then the state has broken out who's going to be eligible for transitional rent when it launches, which will most likely be January 1st across the state. We may have a few managed care plans who opt to offer this in July, but my guess is most will go January of next year. And again, more details are coming out on this. We're waiting for a policy guide update from the state about exactly who's going to qualify for these. But the real intent here for transitional rent is that it will leverage both community supports, so our housing navigation, our housing deposits, and then it will leverage the Prop 1 dollars that we passed last year that'll have rental assistance as part of it. to really house folks in a more comprehensive way. So that's the goal. How this will operationalize, we'll have to see. But anyways, wanted to make sure you're at least aware this is coming. And we're just going to get more guidance in April, I think is when the state has told us they'll put out a policy guide. Next slide, please. So I'll turn it back over to you, Baljeet, so we have time to talk about what different counties are doing.
Yeah, so we just want, and I'm gonna stop sharing so we can see everyone. Just if you have experience already referring to ECM or community supports, we kind of wanted to give an opportunity to talk about that. What are some of the successes? What have been some of the challenges? So just raise your hand and let's talk about it. Anyone refer to a CalAIM benefit or community support? Yeah, go ahead, Tisha.
Yeah, so I used to I'm at a new agency now, but I used to work at a homeless service organization for about 5 years. And so we did refer people to the whole person care pilot, and then after they transitioned into the community support model, we did refer people to the community supports, but it was run by our county healthcare agency, which was on the other side, far west side of the county, and we were on the east side. And it was really hard I mean, just the number of referrals they received. Caseloads were large, so it was very hard for them to serve our side of the county. And then when we did make a referral, they were very quick to unenroll clients that they couldn't find, which is a big, that's one of the main things about unhoused population is they have nowhere to go. So there are a bit of a challenge to find. So our agency did a lot of work to help connect them. So that was mainly one of the issues, like getting people not only enrolled, but maintaining that enrollment was very tough because the county's capacity or the provider's capacity was so full.
Yeah, yeah. Thank you for sharing. And then I did see in the chat, see, is it Chea? As we are closing out cases, we typically make a referral to ECM. So is that for all APS clients or just your home safe clients?
Yeah, that's just for our home safe clients and other rapid rehousing programs that we have as we're closing out the case due to funding issues specifically, knowing that they could still use that support, we are doing the referral to make sure for consistency, just so the client doesn't get left without any supports.
Yeah. And what county are you in?
I'm from Yuba.
Oh, great. And what are you seeing with how that's going in your local county? They're making those referrals.
Well, because the closed loop referral process is not implemented yet, I don't know how it's going. We're making the referral, but I don't know what happens after that. So hopefully when that process gets ironed out, we will know how it's going.
Yeah, definitely. Now, based on our very quick presentation of ECM and community supports, a lot of you are doing the work of that trio, right? The housing trio through Home Safe. Anyone thinking like, yeah, maybe we should become a provider? Don't jump at it. Deshelle.
Yeah, so at our agency now we are developing an ECM program, and the next step is to develop the community supports program with housing supports. I guess one of the biggest concerns though is just the limited amount of housing there is in California in general, especially I mean in Ventura County. There's not a lot of housing and it's very expensive. And if
Right.
you're receiving Medi-Cal and you have high acuity, it's likely that your income is going to be stagnant. It's going to be at this lower level for the duration of your life for many people. And so it's just a matter of like, yeah, we could navigate and find housing, but will we find landlords who are willing to reduce rent? Or I was also hoping that maybe part of the transitional rent services, there's a way to pay for landlord mitigation services because that kind of incentivizes landlords. So sort of incentives, if there's any way, but I don't think that transitional rent will have that. So it's probably about finding other landlord incentive programs out there in the community to really encourage landlords to rent to our clients.
Yeah. Good. And that came out in the survey responses, just the lack of affordable housing, right? Especially in a lot of our counties where housing is so expensive to begin with, right? There's only a few pockets in California left where somebody may say housing is still affordable in this county, right? It's getting smaller and smaller. One of the things I would suggest, and Gretchen, if you can put the link to that collaborative planning meeting, if you haven't already started going to the local CalAIM collaborative meetings that are happening statewide, these are there's a facilitator for the meetings. It's where the managed care plans, the ECM, CS providers, and other stakeholders come together at least once a month to talk about how the implementation is going, where those needs and gaps still existing. And so, as a housing entity or expert now, right? If you've been running Home Safe, you're part of those experts working with homeless individuals. You have a lot to share about what you're seeing with this particular population, because they are the largest growing population in our homeless population, right? Our adult aging population. The other meeting that I think it's important that Home Safe APS folks are attending and raising up the issues that are unique to this population is through your COC meetings, right? So those typically are happening, I think, maybe on a monthly, maybe on a quarterly basis. And the managed care plans were starting to attend those meetings because when CalAIM rolled out, they were able to apply for additional funding from the state to look at investments in homeless and housing initiatives at the local county level. Now, those dollars may have started to run out because a lot of it was done through the COC. But again, it's an opportunity to raise up what's unique about this population of aging individuals that need maybe more than what is being planned out for families and younger adults. What does this population need? So definitely would highlight those two things. Just last on a couple of the last slides here. We do have all these resources here, and we did put the links in the chat. Also, Gretchen and I do provide individual technical assistance to counties. And so we ran through this very fast, but if you want more information, definitely reach out to me or Sharon. She's your adults CFPIC staff person. And we can set up an individual virtual meeting to kind of talk more through this. If you're looking to come on as a provider, last month we did, Gretchen walked us through the cited application, which is a funding source coming directly from the state. If you're looking to come on as an ECM or community supports provider, and there is a recording of that. And that application process has been increased a couple of months to allow folks that want to come into the transitional rent landscape. And so the deadline for that, I think, is like the first week of May 2nd, I think.
May 2nd, yeah.
Yeah. So again, we went through all these slides very quickly. If you want more one-on-one technical assistance and maybe some more guided training, definitely reach out to us and we can provide that. We definitely want to help counties that are continuing to ramp down their home safe programs of looking at opportunities through CalAIM, either as a referral source or a provider. And so I really want to help counties with that. And with that, I'm going to turn it back over to Peter to close out our webinar.
Hi, everyone. Thank you all for attending our CalAIM Brown Bag. Just a quick note, I dropped a survey link in the chat. Just please take just some time to fill out. It should take only 1 minute, and it will provide you with an opportunity to propose any additional topics that we can discuss and talk about in future brown bags. And thank you again for attending, and hope you all have a wonderful day.